Okay, I think we have the full list. Do we have everybody out of the waiting room? So it's 12:30. Dr. Roussin has no specific questions. So over to CBC Manitoba. Alana, one question, one follow-up. Thank you.
Hi, Dr. Roussin. I'm just wondering, when Health Canada approves the COVID-19 vaccine for the age group 5 to 11 and it becomes available in Manitoba,
Recording in progress.
What will the plan be in place for, restaurants and events, sporting events, et cetera, where vaccine mandates are currently required? Will there be a vaccine mandate for kids 5 to 11 to attend those places?
Yeah, and so, at first, certainly right now, that's not in the plans. We are still planning on having the under 12 still exempt, as long as they're entering with somebody who is fully vaccinated. Again, even though as we roll out, there'll have to be a significant delay because people will be getting their first dose, and then we'll have that time in between and receiving their second dose. At this point, we have no plans on requiring proof of vaccine in that age group. Of course, we always, watch how things go, and as we see vaccine uptake increase in that age group, and what we see with our numbers, we may have to reconsider it. But there's no immediate plans.
Okay, and what percentage of cases are currently among, or does the province know what percentage of cases are currently among the 5 to 11 age group?
Yeah, we certainly know that. I don't have the number right in front of me, and obviously there's some fluctuation, but the under 18 age group is making up a significant proportion of our cases, and the younger age groups in there make up a significant proportion. So we expect that once we can offer protection in this age group, and some surveys suggest very significant uptake within this cohort will occur. We're looking to further improve transmission rates, and as well as decrease those rates in school, as this is the largest group of unvaccinated kids that are.
Sorry, Dr. Roussin, you cut out there. If that answer was finished, we'll move to Canadian Press and Steve.
Oh, hi, Dr. Roussin. We don't have the biweekly updates yet. I think they're due today, but we don't have the updates yet in terms of the regional test positivity rates. Have you seen any change in Southern Health, especially where the test positivity rate has been high?
There's been a lot of fluctuation, and that's what we said is the problem with reporting regional rates, but haven't seen any significant changes. Certainly, there's day-to-day fluctuation, but no significant changes. So we'll keep updating that.
And I'm still going through the data that's just been released online by the government. 160 some odd new cases today. It seems to be spread out among different regions in the province. Are we seeing outbreaks anywhere that are new from the last couple of days?
There's always when we have community transmission, we're going to see various outbreaks, but there isn't any significant, outbreaks that are driving numbers in any particular region right now. We're just seeing a widespread transmission, including many of the regions, and much of the same trends we've been seeing up to now.
And moving now to the Winnipeg Sun and Josh.
Good afternoon, Dr. Roussin. Is there much more that can be done in terms of health orders being added to vaccinated or unvaccinated people if the fourth wave really does start to ratchet up here? We have kind of plateaued looking at the numbers a little bit. But if numbers do start to go up, are there more health orders that can be brought in to restrict movement or gatherings within the province?
So I mean, I think that's always the question on the balance of that. We're certainly approaching a level of restrictions that limits the interaction between the unvaccinated. If we see numbers climbing and we see that strain on the healthcare system, then we always have to consider doing more. What that's going to look like depends a lot on the specifics. But with the level of restrictions we have right now, with the vaccine rates that we have right now, if we can get buy-in for what we're trying to do right now, buy-in for those fundamentals, buy-in for following our current orders, we can see that transmission decrease, and we can break up many of these transmission chains if we get buy-in for what we even have right now.
Second question, we're supposed to potentially before New Year's see the vaccination become eligible for 5 to 11-year-olds. At what point do we start looking at the type of environment and situation that needs to exist to start ratcheting back the vaccine passports or proof of vaccine requirements and the restrictions that are in place there? Do we need to see across all Manitoba hit certain levels of vaccination or levels of certain levels of transmission out in the province? I guess I know you can't really put a date on when we'd potentially be looking at getting rid of or phasing out the proof of vaccinations here in Manitoba, but what kind of conditions would need to exist for that to be phased out?
Really, when what we see with risk populations, what we see with transmission, what we see with modeling, that we wouldn't be in a place risking overwhelming the healthcare system. So right now we see that with the level of vaccine we have, with the transmission that is ongoing right now, we still have that risk. So we need to ensure we have these restrictions in place, including the proof of vaccine requirements. Once we get to a level of vaccination, a level of susceptibility in the population, a level of transmission in the population that doesn't put us at risk for overwhelming the healthcare system, that's when we can start cautiously rolling back our.
From CTV, we go to Danton.
Good afternoon. Just following up on that, are you able to say what that level of vaccination is where we would start to see the vaccine passports pulled back, like any specific benchmark that we would have to reach?
So it's really challenging to come up with a specific benchmark because again, when we look at benchmarks like that, we assume that it's uniform uptake throughout the province. So even if you have high uptake but still very low levels of uptake in certain areas, you can still be at risk. So it's hard to put a specific benchmark. It's certainly higher than where we are now, and with that, it depends on this, on a transmission that we're seeing as well. So we can't come up with a specific number per se, but certainly the higher the better.
Okay, we're also seeing two COVID-19 outbreaks in personal care homes. One of the outbreaks has 6 deaths linked to it. Is this concerning to see outbreaks happening again in care homes, and what's being done to address those?
Yeah, so it's certainly concerning, and we've lost far too many Manitobans to this virus, and our condolences certainly go out to the families that have recently lost loved ones. And so, of course, it's concerning to see outbreaks again. What we're doing, we've are recommending the third dose of vaccine for individuals living in these settings. We have the proof of vaccine for required personal protective equipment used, and then we still message is that this virus is still here. It's still transmitting. We can't let our guards down, and so people who are at risk need to be cautious. If you're eligible for being vaccinated, get vaccinated as soon as possible. If you're eligible and in high risk category for your third dose, get your third dose as soon as possible. People working with vulnerable individuals need to continue to take as many precautions as they can. Get vaccinated, wear PPE, do those symptom screens. So I think a lot of work's been done. A lot of people are working really hard to keep those places safe. But unfortunately, when you see high levels of community transmission, you see high levels of transmission anywhere, it's soon going to be everywhere. That's really that purpose of these public health restrictions, and the fundamentals is if we really want to protect those who are most vulnerable, we have to decrease transmission everywhere.
From CJOB, Clay.
Good afternoon, Dr. Roussin. Just a follow-up to the care home, the 2 care homes that have seen outbreaks. I think you just touched on it. My question was, have you identified a principal cause for these outbreaks?
So I think there's investigation still, always going on. I think we look and we find what we would call the index case. I don't have any details to share on that, but we certainly learn from all of these episodes, but I don't have any details to share on that.
Yeah, follow-up regarding the booster shots. Can you give us an update when the third shot, the booster shot, will be available in pharmacies?
Yeah, so I don't have details on that. I know Dr. Reimer is out this afternoon speaking about vaccines, so perhaps she'll be able to.
Thank you.
Thank you, Doctor. Now to Global and Abigail.
Hi there. I just spoke with a couple families earlier this morning. They pulled their kids out of school because of just the rising numbers, and their kids obviously aren't eligible yet for the vaccine. When you look back to when we had remote learning last year and the case numbers right now in schools, is it comparable? Is this something you'd consider remote learning again?
So we've always considered having the kids in school one of the most important priorities. We've always talked about the schools being the last to close, first to open. Overall, we see lower case counts, this wave compared to other waves. Certainly the younger kids are making up a greater proportion of cases than they did in the last waves, because they're not eligible for vaccine as of yet. But we've always had that balance, right? We balance the benefits of keeping kids in school with the risk of transmission in schools, and knowing that there's many safeguards regarding decreasing the transmission in school. So, so at this point, we're taking that targeted approach. We do have certain classes on remote learning when we have outbreaks, and we'll continue to target it as much as possible because we know there's so much benefit to having kids in school.
Just to stick with the school theme, it's parent-teacher interview week for many school divisions, and we're hearing lots of them are promoting in-person interviews. Is this something that we shouldn't be doing? We should stick with those video parent-teacher interviews this week?
Well, I think the virtual option should definitely be there, and we can try to utilize these as much as possible. I do think that people in our education colleagues have the best insight onto the importance of whether these can take place virtually or whether there's a big benefit in having them done in person. Either way, if they are done in person, then many precautions need to be taken. Right? We need to decrease the certainly the amount of people at one time. Need the symptom screening. Need to be masked indoors. Need to be distanced. And so there's a lot of things to consider with that. Certainly the virtual option, should be there. But I will leave it to, the education professionals to decide on how important it is to have at least some of these occur.
And moving to the Brandon Sun, Karen. Karen from the Brandon Sun.
Sorry, just unmuting. I'm just talking about, just looking at, well, we've had outbreaks in schools across the province. So with vaccines coming for 5 to 11, and so would you say now that schools are a major site for transmission?
So certainly we see a significant proportion of cases in school-age children. That's that we see from our numbers. Much of that is through community transmission, household transmission, transmission in other settings. We do see transmission in schools, and that's why we see some classes on remote learning, because we've seen that transmission there. But again, overall, schools have provided a safe environment compared to many other settings in the community. So again, to minimize the risk in schools, to minimize the risk in any setting, in personal care homes, in schools, in healthcare settings, it's key to bring down community transmission. And so that's why we have these restrictions in place. That's why we have these proof of vaccine requirements in so many settings. When community transmission is high, you're going to start seeing transmission in every setting.
Okay. And well, just on that, I'm not sure if you can answer this, but someone can tell exactly how many schools are now experiencing outbreaks across the province?
Yeah, we can get that to you. I don't have that in front of me.
Okay, thanks.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Roussin. Some parents and educators have been using monitors to check air quality in schools. So what are your thoughts on the use of these CO2 monitors to detect the air quality? I wonder if it's something that you think schools should be doing?
So we provided advice to schools and education at the beginning of the year to ensure their ventilation systems were inspected and working properly, and if not, then addressed through some engineering method. And so that's still the message right now. I think it's still a message, an opportune time to revisit this as we move indoors in the cold weather. So it really depends on the circumstances, the ventilation system they have, the functioning of that. So we've made that recommendation, and we expect all schools to ensure their ventilation systems are working properly, and if not, then to have solutions brought.
Okay. In terms of the transmission provincially that we're seeing right now and the infection rate rising, if we continue on the trajectory that we're on right now, will Manitobans be under more restrictions for the holiday season?
Yeah, it's hard to predict, and so certainly I'll be speculating on where we might be. What we know is our trajectory is not in the right direction right now. We know that our healthcare system is continually at risk of being overwhelmed, and so we need to bring down this transmission. And so we do have a number of restrictions in place now. We have a number of public health guidelines out there, and so we really need all Manitobans to continue to step up get vaccinated if you're not already, and follow these public health orders and restrictions that we have in place right now, so that we don't continue to see this trajectory going up, and we're not at an increased risk when that holiday season comes around.
From City TV, Mike.
Hey there, Dr. Roussin. My question has actually been answered already, so I'm good. Thank you.
Moving now to Alexia from Radio Canada.
Good afternoon, Dr. Roussin. I was wondering about, yesterday we saw like a drop in COVID cases numbers. I was wondering, what does it mean? Do you think we may have reached a plateau? Is this like a blimp? What is it?
Yeah, and so we can expect, day-to-day fluctuations. We look more at that numbers are lower than later in the week. We also know we've had some significant weather events which may have affected the amount of testing that's being done. So we don't make much of a single trend.
Okay, and about the 5 to 11 vaccination, what do you think will happen? Do you think it will be a rush at first? Do you think we can see lines of parents waiting outside with their kids to have the vaccine? What do you expect from that?
Dr. Reimer is going to be out this afternoon at a press conference addressing a lot of this, so she'll be better suited for this. I think that our polls that we've seen are suggesting fairly significant uptake in this age group, and so we're certainly looking forward to that. But there's a lot of work being done to prepare for
Okay, thank you. We just lost the tail end of your comments there, Dr. Roussin, but that does bring us through the list. Karen, your question on school outbreaks, I put the link to that data. It is posted online. I put that in the chat. We do have a few minutes for a round table. Any other follow-up questions, please identify yourself and we'll do our best to answer.
Hi, this is Alana from CBC. Dr. Roussin, you said that there's some transmission happening within schools. Can you expand on that further? How does the province track it? Is it the number of cases happening within schools that are linked to the transmission happening there? Is it the number of schools where transmission is happening? I mean, how much transmission is happening in schools?
Yeah, and so what we look at with when we have cases, so we certainly see a lot of cases in school-age children. Of course, just we know right off that doesn't mean they acquired it in school. And so when we see that case, we do a case investigation, look for areas where they may have acquired it, places they had attended during their incubation period or period of acquisition, and can make some judgments from that sometimes. And then we look when we see a case in school, then of course we do a contact investigation within the school. So we look at everyone around that case who's would be considered a contact or at some point in contact with them during their infectious period. And then amongst those contacts, we don't see a lot of transmission. So we do see transmission. So we're not suggesting at all that there isn't transmission in schools, but we're not seeing the same level of transmission that we see in the community. And so that tells us that a lot of the safeguards are working. We don't expect them to be perfect, but really from those contact investigations, that's where we get a lot of information from. And then when we do see transmission from those contact investigations suggesting that it's happening in school, that's when we might suggest.
Oh, sorry, it cut out for a second. So would you be able to say, of the school cases that are listed on the school dashboard, is the province able to say what percentage of those cases are believed to be linked to in-school transmission?
I don't have a specific number in front of me. I think that the significant issue with that is which schools do we, or those are the cohorts where we're suspecting that there's been transmission occurring within that level. So we cases in school, but we're not seeing transmission, then we're just doing our investigation when we cohort and rarely.
Dr. Roussin, is there any work being done in Manitoba right now to ramp up contact tracing and testing? And is that something that public health is recommending should be done?
So right now, our testing capacity is we're not reaching that capacity. So we feel that our testing capacity is good at this point. We still have a very good test turnaround time for that. And same with contact tracing. Our capacity contact trace, we're recently reaching the vast majority of cases within that 24-hour period, or reaching the vast majority of contacts within a 48-hour period. So right now, our capacity in that regard is
Okay, we are continuing to have some issues with Dr. Roussin's audio. I apologize for that. Got time for maybe one or two more questions, then we'll have to wrap things up.
Dr. Roussin, Danton Unger here with CTV News Winnipeg. Just in terms of the outbreaks at the care homes, I mean, you've mentioned the third doses that are available and those precautions, but I guess like with those precautions, we're still seeing these outbreaks growing, and we're still seeing deaths happening within these care homes. So I guess how are these outbreaks still able to grow even with these precautions in place?
So this is the issue we're going to see with high rates of transmission. So when you see high community rates of transmission, that's going to get everywhere. And so that's why we continually move on why we continually speak about the importance of being vaccinated, the importance of following the fundamentals, because the best way to protect the most vulnerable. And so we have a lot of precautions in these places, and despite that, we still see some outbreaks, certainly to a much less degree than what we've seen in the past, and that's a large part to vaccinations. But we still have to be very vigilant in bringing down that community transmission, and with that, ensure we're doubling down on the protective policies that we have in these places.
All right, and that's probably as good a place as any to leave things off. Again, thank you for everyone's time. Dr. Roussin, thank you for yours. This concludes our Wednesday briefing. Thank you.
Thanks, everyone.